Good day everyone, this is Jemermay Dalon and now we will know and discuss about the topic of near drowning. Near drowning is a term used to describe a person who almost died from suffocating underwater. This is the last stage before fatal drowning, which results in death. Near drowning occurs when you are unable to breathe underwater for a significant period of time. During near drowning, your body is cut off from oxygen to the point where major body systems can begin to shut down from the lack of oxygen flow. Most people who nearly drown are young children, which are 1 to 4 years old, but drowning accidents can happen to anyone of any age. In some cases, particularly in young children, this can happen in a matter of seconds. However, the process typically takes longer in adults. Causes of near drowning. The majority of near drowning cases are attributed to accidents that occur near or in the water. The most common causes of near drowning include the inability to swim, panic in the water, leaving the children unattended near the bodies of water, leaving babies unattended even for a short period of time in the bathtubs, alcohol consumption while swimming or on a boat, concussion, seizure, or heart attack while in the water, and unfortunately, the suicide attempt. It is a misconception that you're safe if you're larger than a body of water because you can drown in just a couple of inches of water. Symptoms of someone who nearly drowned. Someone who has nearly drowned may be unresponsive. Other symptoms include cold or bluish skin, abdominal swelling, chest pain, cough, shortness or lack of breath, and lastly is vomiting. Near drowning is not always fatal, but it can lead to health complications. It can cause complications depending on how long a person is deprived of oxygen. Complications of near drowning may include pneumonia, acute respiratory distress syndrome or the ARDS, brain damage, chemical and fluid imbalances in the body, permanent vegetative states. Near drowning victims still require medical attention to prevent health-related complications. Helping someone who is drowning include, it is important to remember that it is possible to revive a person who has been underwater for a long period of time. Near drowning most often occurs when no lifeguard or medical professional is present. You may attempt to rescue the person from the water, but only if it is safe for you to do so. First is use safety objects such as the life rings or the throw ropes to help the victim if they're still unconscious. Second, you should only enter the water to save an unconscious person if you have the swimming skills to safely do so. Then, start to rescue breathe as soon as possible if the person has stopped breathing. Most people survive near drowning after 24 hours of the initial incident. Resuscitation may also be possible even if someone has been underwater for some quiet time. Even if a person has been underwater for a long time, it may still be possible to resuscitate them. Do not make a judgment call based on time. Call 911 and perform CPR. In this way, you may save a life. CPR includes giving oxygen to the person through mouth-to-mouth movements. Chest compressions are equally important because they help increase oxygen flow through the blood to prevent fatal complications. Be careful when handling the person and performing CPR, as the individual could have a neck or spinal injury. Do not move or turn their neck or head. Stabilize the neck by manually holding the head and neck in place or placing towels or other objects around the neck to support it. If the person has near drowned in cold water, remove their wet clothes and cover them in warm blankets or clothing to prevent hypothermia. Be careful to support their neck while removing the clothing. If two or more people are present with the victim, one should start CPR while the other one calls the 911. If only one person is present with the victim, CPR should be done for 1 minute before calling the 911. And the best chances of recovery is to seek help immediately. That is all that you need to know about near drowning. Thank you.